November is Lung Cancer Awareness Month, and here to tell us more about how Austin CyberKnife treats this kind of cancer, in addition to the benefits for their patients, is radiation oncologist Dr. Shannon Cox. Thanks for coming, Dr. Cox.
Yes.
We appreciate it. So you were saying, as we were talking off camera, that the current stats for lung cancer, they're kind of interesting when it compares to other cancers. Can you tell us about that?
Well, lung cancer is the #1 killer of men and women in the United States, even though it's not the most common. Breast cancer, prostate, colorectal are more common. However, lung cancer is the #1 killer. There's approximately 14,000 new cases a year of lung cancer diagnosed, and yet it accounts for about 25% of the deaths.
What would be the very early symptoms?
That's a good question. There's really not any. Typically, for the early stage, there's not. That's why it brings up issues of screening people that have been smoking, because there are not a lot of symptoms. It's not like with head and neck cancer, you'll feel a lump on your neck. There's really not. Occasionally, somebody might notice they cough up blood or may have some shortness of breath, but that's usually the more later stage.
When should screening start, and who should be screened in addition to those who've smoked?
Well, really, screening is pretty much limited to those that have smoked.
Okay.
Yeah, and there are now protocols out there. I think everybody should talk to their family practice internal medicine doctor about the criteria for screening. But if you have a smoking history, maybe a family history, there are screening protocols now of when to screen and et cetera. Yeah.
Very good. So how does CyberKnife treat lung cancer?
And you know, CyberKnife works very well in conjunction with surgery. People that are either aren't surgical candidates or people that are surgical candidates and that are early stage, it's truly amazing. It really is. I'm not exaggerating. In early stage, that used to be somebody had a pretty invasive surgery. It would be painful, painful for up to a year afterwards. With CyberKnife, it's completely painless. It's remarkable. It's in 1 to 5 treatments. It gives a very high dose to a very localized area. Its real benefit is the ability to protect the normal tissues. So frequently we have people that have fairly bad lung function that undergo CyberKnife, and they're not short of breath afterwards. They almost have no symptoms. It's pretty amazing.
Recovery process. It's pretty non-invasive, and they can kind of go about their daily business, right?
Yeah, it's completely non-invasive. Generally, in order to get ready for it, we have to implant some little BBs, we call them markers. That helps the robot direct where to give the treatment. So the only invasive part may be of putting those BBs in, but that's kind of like getting a shot, really. Once those are put in, then the treatment can be given. Other than that, it's actually completely non-invasive. So.
You've seen the treatment come a long way from how it used to be to this process. How is it for people to be able to continue with their daily lives and what they want to do while being treated? It has to be hugely satisfying to you to see that.
Yeah, no, it really is amazing. There are people that advertise you can get your CyberKnife on the way to the grocery store. It's not quite that, but on the other hand, it's almost. And for early stage lung cancer, we see people and follow up a week or two or a month afterwards, and surprising how, I mean, they have literally almost no symptoms.
Thank you so much. It's always a delight to have you.
Thank
we appreciate it. Austin CyberKnife is located on I-35 near the Dell Seton Medical Center at the University of Texas. You can call them at 512-324-8060 or go to austincyberknife.com.